So with that, I'll hand it over to Dr. Christ.
Thanks, Steve. Good afternoon, everyone, and thank you for joining us. For those that don't know me, I am Dr. Cara Christ, the Director of the Arizona Department of Health Services. I'm going to go through some of the current data and where we are on vaccine distribution in Arizona, and then I will provide time to answer questions. So next slide for me, Corey. So after reaching a peak of over 65,000 cases in the week of January 3rd, our metrics are trending in the right direction. So you can see over the last few weeks, we've had continual decrease in our cases per week. From a statewide perspective, we are also seeing decreases in hospital bed use required by COVID patients as well as COVID-like illness. So these are all trending in the right direction. Next slide for me, Corey. And the epi curve that all of you are very familiar with, again, this is the number of cases by collection date reported each day. And so you can see that we did reach a peak after the week of Christmas and New Year's, but we have seen a steady decline since then. And again, for those that are just joining us for the first time, those mitigation strategies that are on the epi curve that are in red are mitigation strategies that are still in place today. Next slide. This is our percent positivity of the total tests performed. This is a little bit different than what you see when you go to the front page of our laboratory section, although it is on our total tests tab when you look at our laboratory section. This looks at what the total tests reported instead of just tests in unique individuals. This is likely a better representation of percent positivity in the state. The dark gray bar shows the number of Arizonans who have never been tested before or are being displayed as a unique individual. The gray are the number of people who have had repeat tests. And you can see that our percent positivity has decreased over the last several weeks. And so again, this is a good sign of our community transmission and that it is decreasing in Arizona. Next slide. This is the trend of the counties and their number of cases. You can see most of our counties are in a downward trend, mirroring the statewide metrics. Some of them are indicated as staying relatively even. That's because they've either had increases, decreases, and then back to increases, or the slope's just not great enough for us to consider it a true decline just yet. But our state is heading in the right direction. So all of that is great news. Next slide. Especially as we head into our vaccination efforts. And so I'm going to provide some updates on COVID-19 vaccine and implementation of our programs here in Arizona. Next slide. So you're probably all familiar with our prioritization chart. There have not been any recent changes to the prioritization. Arizonans 65 and older are still prioritized to be vaccinated in the prioritized 1B. Along with our education and childcare services and our protective services occupation. And so that includes our law enforcement officers and firefighters. So again, these recommendations are made to the department from the Arizona Vaccine and Antiviral Prioritization Advisory Committee, and that's intended to protect those that are most at risk for outcomes due to COVID-19, such as hospitalization and death, and then also reduce the strain on our hospitals by allowing them access to vaccine. This is on our website. As we make new updates, it will be updated, but the majority of the state is currently in phase 1B prioritized. Next slide. This is on the infographic. You can find this on our website at azhealth.gov/findvaccine, and it's the county prioritization link. 11 of our 15 counties are vaccinating people 65 and older, along with the state vaccination sites and retail pharmacies that have been given vaccines supplied from the federal government. So Maricopa County announced that they will be vaccinating those 65 and older starting Monday, February 15th. And as of today, almost 1.1 million doses of vaccine have been administered statewide. Next slide. Again, just a general overview of the vaccine distribution. We did put a blog up about it's very wonky and technical, but of how we figure out the allocations that go to our local allocators, which are our county health departments and 4 tribes. We use a local allocator model so that the partners who know their communities can make sure that the vaccine is getting to those partners to get it administered. When we send out those allocations that we get each week, the local allocators then tell us who they want that vaccine to go to. We then place those orders with CDC, and then CDC ships directly to those providers. They get the vaccine directly. One of the things that over several weeks of these efforts that we have run into is a Monday holiday, which then delays the shipment until Tuesday. So we've been working with our local health departments to make sure that we get those orders in as early as we can, and trying to make sure that we have the vaccine available to cover, knowing that there will be an additional day that week before the shipments arrive. Next slide. So by the week of February 14th, we expect to have 1,490,000 doses here in Arizona. You can see by week what our allocation has been. If you look at the weeks of, if you look at the most recent weeks, you can see that they've been relatively stable. Those are the ones that are down at the bottom. And I'm sorry, those should say February instead of January. But you can see that the amount of Pfizer and the amount of Moderna that we've gotten is staying steady. According to our 3-week forecast, we anticipate to receive that same amount of vaccine over the next few weeks. These doses contain both first and second doses, and then these allocations are split between the 15 counties and 4 tribal local allocators, the state, and then the CDC Long-Term Care Pharmacy Partnership Program. Next slide. So here's how the allocation will look as we move into the week of February 14. Here you can see the number of doses that are allocated to each county. It's important to note that the doses that we order yesterday and today are not in the state just yet. They will arrive sometime between Tuesday and Friday of next week due to our federal holiday. And again, these are both first and second doses. Next slide. So at the current rate of vaccination in Arizona, we're vaccinating over 215,000 doses per week. We are currently outpacing the state's weekly vaccine allocation from CDC. We resubmitted a federal resource request for 300,000 immediate doses and followed with 300,000 doses per week, along with the ancillary supplies to ensure that we can support the vaccinators on that. ADHS, in coordination with the county health departments, also requested FEMA vaccinators and administrative support staff to increase vaccination site throughput. And Governor Ducey's Executive Order 2021-01 emphasizes the importance of timely reporting to demonstrate our success rate. And any vaccine that is unused within the 7 days of receipt, we can work to reallocate that to partners who are able to use it so that we are showing that we are keeping up with the amount of vaccine that we are receiving in Arizona. So last week, we activated the Phoenix Municipal Stadium pod that has a capacity very similar to State Farm Stadium. And we are working with the University of Arizona and the Pima County Health Department to establish a Southern Arizona pod in Tucson. And so that will open up at the end of next week. As of today, over 1,096,000 vaccines have been reported administered in Arizona. We have over 500 provider sites that have received vaccine and vaccine supplies, including county health departments, hospitals, our FQHCs, which are the federally qualified health centers or the community health centers, pharmacies, and other key providers. And we've had over 1,700 long-term care facilities that have received or continue to receive support from our CDC long-term care pharmacy partnership program. So far, over 63,000 shots have been administered through that program. And this week, starting February 11th, the CDC activated the CDC Retail Pharmacy Partnership Program. That is a program where the pharmacies will receive a federal allocation of doses on a pro rata basis based on population by the states. We have 284 pharmacies, including Fry's, Albertsons, Safeway, and Walgreens, that are scheduled to receive a limited supply in their store and be able to allocate that out. Next slide. This week, we launched our new vaccine dashboard, which provides information about the doses ordered and administered, as well as demographic information. You can click on the county or the state pods to see the specific information broken down by jurisdiction. This continues to be a work in progress. We have additional ads that we are planning to do. We just wanted to get our vaccine webpage up. And so we will continue to add, including percent utilized, as well as the population, the rate that the jurisdiction is vaccinating, and we intend to add zip code data as soon as we can to that website. Next slide. We have seen a significant improvement in our percent utilized across the state thanks to the executive order. You can see that right now, from a statewide perspective, we are at 80% of our doses utilized. That will continue to go up until Sunday. Every Monday, we update with that week's incoming vaccine. So you will see that on Mondays, that percent utilized will drop because some of that vaccine won't even be in the state as of that time. But we are up higher than where we were several weeks ago when that executive order was issued. Next slide. All right, I'm going to go through some frequently asked questions that we get. The next slide, please. So how do I find a vaccination site? You can go to azhealth.gov/find vaccine. We have an interactive map of all of the locations that have a vaccine. There are registration links if you click on specific areas that you would like to go. Some vaccination sites are not scheduling appointments through our vaccine management system at Pod Vaccine. And that is because that's a voluntary system if people wanted to use it. But some already have electronic medical records or registration sites that they are working on and will have their own independent registration link. So make sure that when you pick that site that you select the vaccination site and click the registration link associated with that site. Next slide. So if you'd like to make an appointment at a state site, there's a couple of ways to do that. You can go to our ADHS patient portal at podvaccine.azdhs.gov. We do have a step-by-step instruction and video on how to make an appointment, along with FAQs. There are more vaccine provider and registration information on our website at azhealth.gov/find vaccine, or you can call the number 1-844-542-8201 to be connected with somebody who can assist with scheduling. And we do have bilingual options available through that line. The one thing that's very, very important to note is that appointments will be based on vaccine availability. And so as of right now at our state sites, we are fully booked through the end of February. As we continue to look at our vaccine allocation, we will continue to add additional sites as we find additional vaccine. Next slide. So we want to thank our 211 and our Arizona Poison and Disease Information Centers partners. These hotlines are going to refer back to our county health departments when they're appropriate. Again, for getting an appointment, it is completely dependent on how much vaccine that is currently available in Arizona. But as you call the hotline, they will review what the caller's need is. Specialists will ask you screening questions If you are eligible, they will do a warm handoff to an ADHS navigator that will help locate and schedule that appointment. If the person does not meet the eligibility criteria, the specialist will provide information on Vaccine Finder, so that they can find out when they may be eligible for vaccine. The navigators are available to assist those eligible calls with scheduling appointments in the patient portal, as well as searching and looking up previously scheduled appointments. So they are available 8 to 5 in both English and Spanish. Next slide. All right. And with that, we will answer, I guess I'm the only one answering questions. I will answer any questions you may have. So thanks.
Okay, first up is Cameron.
Hi, Cameron.
Hi, Dr. Chris. Thanks for taking our questions. I've got a couple for you.
Yeah.
You've released the data that breaks down, who's getting these vaccines.
Yeah.
What is your biggest takeaway from looking at that data? And if there are areas of improvement, how will you address those areas? That's my first question.
Yeah, absolutely. So, one of the things we've been looking at our race and ethnicity data as well as our age data. Right now, we don't anticipate that the race ethnicity data would mirror that of the general population, because we've been so targeted and prioritizing people pretty much based on their occupation. And so as we get further into our essential workers and the general population and adults with medical condition, what we're hoping to see is the groups that have high risks or more vulnerability. You will see those numbers come up. We've been working on several initiatives in order to be able to reach some of those harder to reach populations and high risk groups. We've been working with leaders and specialists in the community that as the vaccine opens up, we will be working directly in high risk zip codes and high risk areas to target that for high intensity direct communication, as well as scheduling community-based pods in those areas so that they don't need to travel. We've also been working with some partners on scheduling transportation for those that may not be able to get transported or may not have their own transportation to go to a vaccination site, but that's things like working with Access to do the non-emergency medical transport. The team's been working with Uber. One of our specialists has been working with a number of other transportation companies so that we can include that when people are scheduling their appointments. I believe our high intensity communication strategy kicked off in one of our high risk zip codes today. We will continue to expand that and work with our local public health departments to make sure that we are messaging messages that are culturally competent, that resonate with those communities, and working through those communities to build trust.
Will the so I know the federal partnership with pharmacies is, they actually come with a federal obligation. Will you still be tracking that locally for those who end up going to those local pharmacies to get their vaccines? Will we still keep track of that data? Because I assume a lot of the general public will begin to get those vaccines from pharmacy locations like that now that this is being rolled out in this way.
Yes, so that's actually a really great question, Cameron. So if you look at our percent utilized, so anybody who administers a COVID-19 vaccine, even if they're working through the CDC federal, the long-term care or the retail pharmacy partnership, they have to report that immunization administration through ACIS, which is our state immunization registry. And so you'll see like Yuma, or I think last week, Yuma County was at like 105%. And that's because those doses aren't allocated or ordered by Arizona, but they're still inputting them as administered. So we will get the doses administered. We did talk to our federal partners, and they should be releasing the number of doses that they are allocating to each pharmacy. And we worked with CDC to identify because really what we want to do is target some of those pharmacies and some of those hard to reach communities so that it's one more available option for those individuals to get vaccinated.
And my last question, I'll make it quick. Supply is focused on supply. What are we hearing from the administration about supply? We know that we've heard some recent announcements. And how much will the opening up the retail pharmacy program, how much will that help our state when it comes to a boost in supply? That sounds like an extra supply boost just in itself.
So yeah, you're absolutely right. What we're hearing is that our state allocation will remain steady. So about that 170,000 doses that we've been getting the last couple of weeks. We anticipate that probably until the beginning of March. We did hear that the federal administration was able to secure more doses. And so that will, and those should be here by this summer. So that will really help us get that out. Not right away. But the federal allocation that went to the retail pharmacy program, that was 1 million doses that the federal partners had that then they allocated to the states on a pro rata basis on the population. And I believe we got about 20,000 doses statewide. So it sounds like there are a large number of pharmacies out of that 283 that may have gotten like 100 or 200 doses. So that's extra vaccine. So you're right.
Next is a Howard Fisher.
Hi, Howie.
Hang on a second.
Oh, I don't hear you.
There
you are.
Is that better?
That is better.
Yes. But I missed you last Friday. I'm telling you, if we don't do this, I don't know it's Friday.
I know. I missed you guys too.
Oh, that's sweet. A couple of quick things. First is technical. In terms of the 1.1 million, how many of these are primary and how many of these are secondary doses? Usually it's broken down. I didn't see that on the slides this week.
Oh, goodness. I think it was on the top. Let me see. It's on our dashboard now. Let me go back to the dashboard. I did not memorize those numbers right off the top of my head, but I want to say it's over 800,000 first doses. Here it is. 843,441 first doses and 242,330 second doses. So if you go to our new dashboard, Howie, we put that up at the top. It's kind of in a row at the top of the vaccine dashboard, and that does change as you go to the jurisdiction so that you can see the total number of doses administered in that jurisdiction, the number of first, the number of second, and the total number of doses ordered by that jurisdiction.
Last two are fairly quick. You're opening up this new pod site in Pima with U of A. Is that going to reduce the allocation to everyone else in Pima County, or is that a separate allocation?
So it will initially come from the Pima County allocation. Now, what we are doing with this was a pre-existing pod. The University of Arizona was very interested in partnering with the state and Pima County Health Department to expand its hours and to expand the capacity. So what we're going to be doing is we're going to be working to expand some hours. They will, I believe, expand it by an hour starting on our soft launch, and then by Monday they will be expanding it by 4 or 5 hours to get it through. We don't have enough vaccine for them to go 24/7, but eventually what we are hoping will happen is we will start getting enough vaccine to where we can give them and Pima County more vaccine. That's our goal.
So nobody in Pima who's giving now is going to be shorted as you ramp up the U of A site?
What we may do is allocate some of the doses, the Moderna doses, because they are going to be switching from a Pfizer site to a Moderna site. Some of that initially may get taken out of the overall pot, but then eventually no, as we start supporting the state sites and getting more vaccine into what we would hope is doing that same kind of thing, is keeping their allocation steady and then pulling off additional new vaccine to go into those sites.
Okay, and then finally, you start talking out toward the summer.
Yeah.
Recognizing a certain percentage of people won't get vaccinated, and you may have some ideas on that number, but when will everyone who wants a vaccine in Arizona be able to get it based on your extrapolation?
So we're hoping by the summer we should be in phase 3, which is where there's enough supply to meet the demand, and then we have people that don't want it, so we'll have excess supply. That's what we're anticipating right now, but we'll be doing some targeted communication strategies to try to increase confidence in the vaccine and get as many people vaccinated as we can.
So are we ever going to get to an 80%, 75-80% where you have the idea of herd immunity? I mean, you've seen the numbers, you've seen the polls, you've done your own polls.
Yeah.
You've got, are we ever going to get to a point where we'll have herd immunity in Arizona?
I really hope so, Howie. I think some of the promising things are, we had that 55% before any of the data was filed. So that was promising. So over half of the people, even before the data came out, were ready to do it. The most recent poll I saw showed about 63%. So it continues to climb. And as we see more and more people get vaccinated and have good results, I think that that's promising. And so I'm hopeful.
Fair enough. Thank you, Doctor.
Thank you, Howie.
Next, I believe this is Alex in Tucson.
Hi.
Hi, thanks so much for taking my question. Do you think Arizona will get enough people vaccinated before a new, more contagious strain can establish dominance in the state? And going off of the same question and going off of Howie's question just now, when do you project we'll have 30% of the population vaccinated, and what about 50% of the population?
So we are. So going back to the initial question, we are in a race against variant strains of COVID-19. What it does look like is that the current vaccines are effective against the current strains. But as we've seen, those spread more easily. And so that's why we are trying to get as many Arizonans vaccinated as possible. It's just going to depend. Right now, our metrics are trending in the right direction. So our community spread is decreasing. What we're hoping is that Super Bowl didn't play a large role in increasing that transmission and that we make it through spring break okay. But all of that will play a role. As we look at the vaccine, so we do anticipate having vaccine for everybody who wants it by the summer. And that could change based on the vaccine supply, but there are some promising things on the horizon. So the Johnson & Johnson vaccine, they are going to have their FDA hearing by the VRBPAC on the 26th and 27th. That should hopefully make that third vaccine, which is a 1-dose vaccine, available by the beginning of March. That will be great, and it will be a wonderful resource for us to get into those hard-to-reach and vulnerable communities if we only need to vaccinate them one time. So that will be a great thing. Right now, we've had about 10% of the population vaccinated with 1 dose. We're doing about 215,000 doses a week. If we can keep up that that level, it should be another month, hopefully, before, and keep in mind, we keep expanding and accelerating the rate of which we're vaccinating. So probably another 4 weeks to get to 20%, another 8 weeks to get to 30%, based on our current rate.
Thanks. And what about fully vaccinated with 2 doses?
Yeah, so that's going to take a little bit longer. So right now, we've got about 250,000 people who are vaccinated with both doses. So that will take a little bit. I would imagine that would lag 4 to 5 weeks behind the other dates that I gave you, if I had to guess in my head.
All right, and just one last thing. And
yeah.
Are you planning on a new, more contagious variant establishing dominance, or do you think we'll get out in front of it?
So, as we watch the transmission spread of that variant in other countries, like where it started in the UK or where it started like in South Africa, it does transmit pretty quickly. I would imagine by April that will be the predominant strain. But these viruses are so hard to predict, especially with as much mutation that they do. So we continue to monitor and work with our CDC partners and our laboratory partners to monitor for the variants. And we do know that we've had cases of the variants here in Arizona.
Thanks so much.
Yeah.
Next is Max Gordon.
Hi.
Thanks for taking my question.
Yeah.
So Maricopa County's vaccination dashboard shows that historically underserved communities like South Phoenix and Maryvale are being vaccinated at significantly lower rates than more affluent communities like Scottsdale or Gilbert. My question to you is, what's your reaction to this, and what is the state doing to make the vaccination process more equitable?
So that's a great question, and it's something that we've been working on for a long time. You know, as we move out of these very specific professional-based phases, we will be expanding the reach and where we are providing vaccine. And so what we are doing is trying to move into pharmacies and community health centers in those areas, working with partners such as Equality Health and Chicanos por la Causa to help be able to register, get people appointments, get people transportation to appointments, or get the appointments into the communities where those individuals are. So as we get more vaccine, you will start to see more smaller-based community vaccination events. And so that is our goal, is to get into those communities, especially as we move into phase 1B, which will have a lot of our essential frontline workers and will expand to more of the general population.
My next question is on contact tracing.
Yeah.
Is the state still doing contact tracing? How long does it typically take to reach people who've tested positive, or the people who've come into contact with someone who's tested positive, and how are things going on the contact tracing front?
Yeah, so we have continued to do contact tracing. The state, we've got about 600 people that do contact tracing. We diverted several of those, though, to help us with our call center. But our goal is to reach people within 48 hours of their results as they're reported, so that we can follow up, identify, where they may have been, who they may have been exposed, so that we can follow up with those contacts.
Last question for you is about racial data in vaccinations. As you mentioned, there's a high percentage of unknown racial data. Why is this? And who are these people that are not, I guess, providing their racial data? Do we think that there's actually a higher rate of minority communities that are being vaccinated than we're seeing reported? That's my question for you.
Yeah, so when you look at the state pods, if you're using the VMS, it's a required field. And so these are people who are going on, registering it, and filling it out. There's an other or unknown category. So other can be people who identify with multiple races or multiple ethnicities. And so that's a little bit harder to tease out. What I will say is historically, race and ethnicity has been something that's very difficult. We don't get that data completely. However, I will say it shows promise, because our race and ethnicity data for our vaccination is actually much better than it is for our cases and hospitalization. But we do need to leave that unknown or other in case people don't want to give up personal information or are uncomfortable sharing with that. But we have encouraged to our call center, to our people who are at our state vaccination sites, this is a very important piece of data, so please make sure that you are asking for it. If someone declines, don't push them, but we do need that information so that we can identify what communities we still need to target outreach to.
Excellent, thank you.
Welcome.
Next is Stephanie Ennis.
Hi, Stephanie.
Hi, Dr. Christ. Thanks for taking my question. I just wanted to ask about the dashboard.
Yeah.
So moving forward, this 1.1 million of doses administered, is that a good number for us to use? Does that include IHS and the VA? Is that a completely comprehensive number now of people who have been vaccinated in the state?
So it is not a completely comprehensive list. It's our federal partners are pretty good about reporting to us. They are not required to, though. However, we do have some data sharing agreements with some tribes. They will input things into ACES, but they are not required. So it's not 100% of our tribal entities or the VA. I would need to check in to see if the VA is reporting. Historically, ACES it was started as a pediatric or a child immunization registry. Adults are not required to be input into it. This is the first time that we've required that. And so let me check to see if the VA got online with that or not.
But the retail pharmacies, as you said, will be included in that.
Yes, so the retail pharmacies are included in that, as well as the CDC Long-Term Care Partnership Program. So they are
great.
required.
Actually, so it's a pretty good number. It's just missing a couple. It could be missing a couple of things. Right?
Yeah, it could just be missing a couple of things. And we do have some IHS facilities that do reports, but it's just not 100%, but we're getting the majority.
Great. Well, thank you so much.
Next is Nicole Ludden. I hope I pronounced that right.
Hi, Nicole.
Yep, that's correct.
Perfect.
Hi, can you hear me okay?
Yeah.
Awesome. So my understanding is that vaccines are allocated on a pro rata basis of the population on the phase of each county is in.
Yeah.
I think you touched on this a little bit in the chart you showed in your opening comments, but could you explain exactly how the state determines how many people are eligible in the phases each county is in? Do you look to the counties to provide that information, and how is that done?
Yeah, absolutely. So what we do is when we get the allocation, we take a look at what phases the counties are in. Right now, most of our counties are in some phase of 1B. We have population estimates from the U.S. Census Bureau as well as the Department of Labor. So we know that our estimates for the populations in each of the prioritized areas, they're not mutually exclusive. So if I was over the age of 65 and I had a medical condition and I was still working as a teacher, I might be counted in all three of those groups. But we list what our population, if you go onto our website on our vaccine information page, you can see what our population estimates from the statewide basis are. And then we have that broken down by county. We then use that formula for the percentage. So right now we're using the 1B. And we take a look at the number of Pfizer doses and the number of Moderna doses. We identify how many of the second doses we have, and we use those second doses to fill in for the counties that got them for Pfizer 3 weeks prior and for Moderna 4 weeks prior. So those get loaded in. Then we take the first doses and we use the population calculation to determine the number of doses that should be allocated to each county. For those counties that have the pods, what we do is we take out the number of doses that we need for those state pods, put that to the side, and then take the other doses and allocate that to the county for them to do. Now, with the executive order that Governor Ducey issued, it's the 2021-01, that does require that counties that have more than 40% of their doses remaining to either work with the department to develop a plan or they don't get additional vaccine. And that same thing goes with providers. So there may be some adjustments that need to be done if somebody doesn't fall into that criteria. And then we will work if there's special programs. Like if a county's like, I don't need this vaccine this week, then we may identify a county that's doing a big pod and say, well, this county's not using these doses. We're going to transfer over 1,500 doses to this county because they want to do a mass vaccination pod this weekend. And so then we'll shift around based on those special priorities, send it out to the counties, and then the counties let us know where they want those doses to go. There's also that confusing issue about like the minimum number of doses. So for Pfizer, we have to either round up or round down to that 975. Or we have to, for Moderna, it's easier because it's minimum doses of 100. What's really going to cause some consternation this week is that they have decided that you can routinely get that 6th dose out of Pfizer. So I'm just going to caution everybody right now on the 15th. Oh, apparently Siri's talking to me. On the 15th, they will include that 6th dose. So instead of allocating the 975, of which we've still been getting that 6th dose, they will be allocating the 1170 that you will get in each tray. And so that's going to look like we got a significant bump in doses, but it's actually level setting, just making us technically able to record that 6th dose. So next week it may look like we get a huge increase in Pfizer, but it's going to be level. But then the counties then will tell us where they want, and we place those orders, and then it goes to the recipients of it.
Gotcha. Thank you so much for that clarification. And then since the state is vaccinating 65 plus while Pima is still in 70 plus, will that allocation go to Pima County? Will that allocation going to Pima County, will that increase to include those above 65? And if so, would that increased allocation only be supplied to that state-run U of A pod?
So as we're doing the 65, we're already including that in everybody's population estimate. So even if they're not doing that, we are including it just to make it simple. But so it won't increase it now, but what we're hoping is as we get more vaccine, it will increase the allocation to the areas that have those state pods.
Thank you so much.
You're welcome.
Nicole Grigg.
Hi, Nicole. I don't hear you.
Hi, Dr. Christ.
Oh, there you are.
It's been a while.
Yeah.
Oh. Can you hear me?
Now I can.
It's been a while. We just want, okay, you can hear me now? Good. I wanted to switch gears though, as we are now approaching 15,000 deaths. And I just really am curious, why do you still stand by your decisions that you've made? Over the summer, you did the report in the CDC about how successful Arizona was in the summer with all the mitigation measures that worked, but you didn't do them in the winter surge. So the fact that we have the week of January 10th, we had 993 deaths in 1 week. Could you have tried to do more to prevent those deaths?
So the reason we didn't implement mitigation strategies was our mitigation strategies were still in place for this summer. And so we knew that if we implemented new mitigation strategies, they weren't going to impact where people were being exposed, which is in homes and in those private settings during intimate gatherings. We continue to monitor the data, and even just one death is horrific. We are going down in all of our other metrics and continue to monitor. We know that the death data lags behind, and so we will probably continue to see deaths for a while.
In the triple digits then. And my second question, we have not seen the governor take part in a COVID briefing since before Christmas. Do you know why? And I'm also curious if you have actually spoken to any families in Arizona directly who have died from COVID-19.
So I know that the governor's been doing some interviews. Because we get so technical with formulas and stuff here, it doesn't really make a lot of sense for him to join us here. I don't know when the next briefing will be. And yes, I have talked. I mean, I've been out, I've been vaccinating people, I've been talking with families. And so, yes, I've been touched by a lot of the different stories that I have heard.
Okay, thank you. And that's why, you know, with 15,000 deaths now, I just didn't, do you feel that there was anything more you could have done in Arizona? Thank you.
Yeah, thanks, Nicole.
Nicholas Gerbis.
Nicholas?
Good morning, good afternoon, Dr. Christ.
Hi.
I was having a little trouble unmuting there. So just a couple quick questions. First, when the Tucson pod opens next week, do you have a sense of how many appointments that'll have available?
We are working on that right now to see, because it's going to be phased in. So they already have some appointments scheduled, and we're working with them on transitioning to the state registration system and how that will build out. So we should have more answers to that over the weekend.
Okay, will you be putting out some information on that then over the weekend or Monday?
Yeah, so as we get closer, yeah, we'll be putting out information, and the appointments will open Tuesday morning at 9.
Thank you.
Yeah.
So my other question is, you know, I've and my colleagues have been hearing quite a few reports of ineligible or confused people being able to book appointments on the state appointments site and then getting turned away when they show up to get their vaccinations. Why isn't the website screening out these ineligible people, and why is it misclassifying them or sending them to the wrong places? And is there something that's being planned to deal with that?
Yeah, so we are continuously making updates to our website and working with our partners, Google and MTX, who built the website. You know, a number of enhancements went in place, like to help people find new appointments so that you don't have to search day by day. That was my frustration when I had to use it, as well as not having to re-enter. So we are working on that. It sounds like there's a couple of different issues that may have impacted some of those. One was that the screening tool for a certain number of appointments wasn't activated. That now has been reactivated, so that should go away. The other thing is, given the such high demand and the limited number of appointments we have, and my team is on this to fix this for Tuesday, but people would get a like whirling circle. And so you would wait for you would hit confirm, you'd get this circle, it would just keep circling. What people started doing was taking screenshots of that appointment that wasn't actually confirmed in the system. What we were trying to do was to try, if they thought that they had an appointment and they were over 75 or they met one of the criteria, we were trying to accommodate those appointments, especially at the beginning before we could get the messaging out. But we continue to work with our website developers to continuously improve that as we open up new appointments.
Okay, thank you.
Thank you.
Jorge.
Oh, hi, Jorge. I don't hear you.
I asked him to unmute.
Oh.
Let's give him a second here. There we go.
Can you hear me now?
Yeah.
Hi, thanks for taking my question, Dr. Christ. This is Jorge Valenzuela from Univision, Arizona.
How are you?
So I have great, and you?
Doing good.
Awesome. Well, we have a single question. We know that the vaccine tourism modality began here in Arizona. This means that people are bringing their relatives from Mexico or Central America to obtain the vaccine here. The question is, how does Arizona control that vaccines are administered to Arizona's residents and not people coming from other countries, like in this case?
Yeah. So we do not encourage vaccine tourism. We haven't seen a huge number of like tourists from inside the United States. What we would do, though, is encourage, you have to have an appointment at most sites in order to get vaccinated, or you have to be scheduled through an employer-based site right now, since we are in phases. We have asked, we've given the Retail Pharmacy Partnership Program specific criteria that they have to screen for. One of the things, though, that we would caution is we are not requiring residency in order to get vaccinated here in Arizona. And that's because, our infectious diseases, they don't know borders, they don't know residency. And what we want to make sure is that Arizonans are protected. And so if we've got winter visitors, if we've got migrant agricultural workers, if we have people, during the winter, we get a large influx of people who are experiencing homelessness. We want to make sure that they are protected, and that if we can avoid having people utilize hospital resources by vaccine, that's what we want to do. So we want to make sure that anybody who comes into contact with Arizonans or our community is protected, because they still can spread and become infected with COVID.
Thank you so much for your answer. Have a happy Valentine's weekend.
Oh, thank you. You too. It's my 10-year-old's birthday is Valentine's Day. I told him he's the best Valentine's Day gift I ever got.
Oh.
So we're excited.
Next is Patty in Tucson.
Hi, Patty.
Hi, Dr. Christ. Can you hear me?
I can. How are you today?
I'm fine, thanks. Thank you for taking our questions. So my understanding right now is that Pima County will receive less vaccine next week, 16,330 doses compared to the 17,850 we received this week. And as a result, we are going to need to severely cut the number of first doses that we're going to be doing. And I wondered if you could please comment on that from a public health perspective, what that means to now be reducing the number of first doses we're giving out.
Yeah, so they will actually be getting more doses. The number of doses that we allocated, that 16,000 number, that's what Pima County will be able to allocate. They will still get the 5,800 doses of Pfizer, but what we're identifying is that because our Pfizer is so limited, we need to work directly with the pods to identify the number of appointments that they have, so that we can make sure we're meeting those needs and allocating those directly from the state. So there's another I think it's 5,850 that they will be getting. In addition, we have held back 3,000 Moderna doses, or I think it's 2,000 Moderna doses that also will be going to Pima County, but Pima County no longer needs to allocate to the state pod. We'll be doing that. So we're working with all of the partners on that, but they are actually getting more vaccine this week.
Okay, so just to make sure that I understand you correctly, will the Pfizer doses then be going to the new, no.
No,
Okay.
so we'll be working with TMC, the U of A, and I think there's one other site that gets Pfizer to make sure that they've got the vaccine allocated that they need for their appointments.
Okay.
Yeah.
So out of this, the allotment that we're getting this week, will the state site at the U of A be utilizing those doses, or will there be a separate amount that will go to the U of A site?
So the 2,000, we're working with them on that right now. We've set aside 2,000 for the U of A, and working with them on how much they currently have and what else they need.
Okay, so we've got 16,330 and then another 5,800 of Pfizer, and then another 2,000 going to the state site?
Yes, yeah.
Okay, so those are all separate amounts?
Yes, so those are all separate amounts. But when you look at what we are putting into the allocation tool for Pima County to decide where it's going, that's the 16, I think it's like 16.3. Yeah.
Yeah, that's right.
Yeah.
Okay. And so will everyone who got a first dose of Pfizer be able to get a second dose of Pfizer? And if they can't, is that a concern?
Yeah, so right now we do have second doses to match first doses, and we are covering all of those appointments, and then we will be reaching out. We don't know how the Tucson pods are doing the ones that are under the county are doing their second appointments, but our intent is to make sure that everyone who gets a first appointment also has a second appointment.
Okay. And it is, but are you saying that it isn't your understanding that we will need to cut first doses? Because I'm hearing from our health department here that we will.
I'd have to see what their plan was. They may not have realized that we're also still going to be allocating those doses of Pfizer, as well as allocating Moderna to U of A. So we're working with them on that, but I don't know how many first doses they had planned.
Okay. All right. Thank you.
Yeah, absolutely.
Okay, next is Carlo Navarrete. I think you're unmuted.
Hi, Carla.
Hi, how are you, Dr. Christ?
I'm good. How are you today?
Good, thank you. Thank you for taking my call. So I'm focusing in on the racial component of the vaccine rollout. And I spoke with Equality Health today. They tell me that they're working on creating these micropods. Can you comment on when those may become available? And are they going to be in communities of color, primarily Maryvale, South Phoenix? Are they going to be established in areas that people in the community are familiar with as far as COVID-19 testing sites in the past?
Yeah, so we have been working with Equality Health. What we asked them to do is to give us their plan for about 5 to 10 consistent stationary sites. Some of them may be where the COVID-19 testing sites were, some of them may be new. But what we've asked them to do is to target them all into like highly vulnerable communities of color so that we can reach out to those communities. And we'll be providing support through financial, through staffing. We anticipate that will start hopefully in March. And that was one of the providers that we talked about, that could potentially be a great partnership to use the Johnson & Johnson, the new one-dose vaccine that's coming out. But we're working with them, and that's exactly the intent.
Do you know if those would also be like maybe the State Farm, 24-hour running site, or is there not such a demand? Or I don't know. Is there a time frame that those would be running?
I think it will depend on what plan they give us. We're always happy to support 24/7, but sometimes for those smaller sites, it might not make sense. But the other thing that what? Sorry?
No, I didn't have a question. Sorry. It must have been my child in the background.
Oh, that's okay.
Sorry.
But the other thing that we're looking to do potentially, if people want to go to the 24/7, is looking at partnerships so that we can provide the transportation for them to get to the 24/7 site. Right now, it's just the one. We're hoping soon it will become all three. But understanding that people have different schedules and different hours, and we want to make sure that people have access to the vaccine.
And then the registration portal, is that going to be in Spanish starting on Monday? Is that correct?
Yes, that is what we are working on. So we are hoping we are going to be testing it this weekend, and then hopefully it goes live on Monday.
Okay, and then one last question, because I know there's others who have questions as well. One thing that the person from Equality Health mentioned is that he's seen a decline in COVID-19 testing these last couple of weeks, and so he mentioned that this whole strategy needs to include people to continue to get tested because that gives them their health status. Have you seen the same type of trend? And maybe it's, we're done with the holidays, we're kind of getting back into the routine of work, but can you send a message out to the community about maybe the importance of continuing to test if you feel you've been exposed?
Yeah, absolutely. So we are seeing a decline in the number of tests being performed. It's still a very large number, but what we've identified during these surges is as we get more cases, the demand goes up, and then the demand tends to taper off. We would encourage people, especially if you've been out in large groups or attended a function where you didn't have a mask, to go get tested, because we do know that there is a high percentage of people who are asymptomatic who can transmit this. And what we're trying to do is to protect those vulnerable individuals from having COVID even come into contact with them. So it's always good to know what your status is, especially if you're going to be attending a function with loved ones.
Thank you so much. Have a great weekend.
Thank you. You too.
Next up is Bud Foster.
Hi, Bud.
Hello there. How are you?
I'm good. How are you today?
I'm doing very well. Thank you very much for taking my question.
Yeah.
If you look at the vaccine data dashboard, it says in Pima County that they have ordered 189,725 doses. They have administered 180,607. That is 95%. And it says 95% utilized. Can you explain to me what that means when they say 95% utilized?
Yes. So as you look at the number of doses ordered, that gets updated every Monday. And so we take the total number of administered doses and divide it by the number of ordered. Now, the number of administered is going to include all of those doses that have been administered through vaccine that was allocated to them, but it will also include vaccine if they've got federal partners that are reporting, or if the long-term care pharmacy program goes into a long-term care or does a retail, they will report also. And so it's really just the percentage of the number of doses that have been reported as being administered to an individual divided by the number of doses that have been ordered by that jurisdiction.
Is 95% utilized worrisome because we have the second doses obviously coming up? Is 95%, does it show that they've been very efficient, or is this something that's worrisome?
No, so I think that's, I would look at it from both ways. I think that it shows that they've been very efficient and we are using what we have on hand. Now, on Monday, that number will change again because the number ordered and allocated to them will increase. But worrisome because as a state, we are outpacing the vaccine that is being provided to us from our federal partners. So that's a concern. But Pima County is doing exactly what we're asking them to, which is to get doses into the arms of Arizonans. We don't want to be sitting on doses, so they're doing a great job.
Right. And it has nothing to do with second doses or anything of that sort, the utilization?
Right, so that is just total doses administered over total doses ordered. So that's first and second doses.
All right, thank you very much. I really appreciate it.
Yeah, you're welcome.
Austin Walker.
Hi, Austin.
Hello. Hi, how are you doing today?
Good, how are you?
Very good. Thanks for taking my question. I just have two really quick ones.
Yeah.
The first one is, I know we kind of touched on it beforehand, but I know President Biden did just release a statement that says all Americans can be vaccinated by July. Is that actually realistic? And if so, how many doses would we need here in the state to make that happen?
So it could be realistic. Keep in mind that's every American that wants to get vaccinated can get vaccinated. If we wanted to vaccinate all, 7.3 million Arizonans, right now we would need 2 doses for each of those. So it'd be about 14.6 million doses that we would need. However, we know that we're probably looking at 50 to hopefully, Howie, 70% And so then that would be the 7.6 million that we might need if we were going for about a 50% vaccination rate by that time. It's going to depend, though, because when the third vaccine comes out, that's a 1 dose. So that's a game changer because you only need 1 dose to get its full effectiveness. And so we'll continue to monitor and see what that looks like. And we are hearing that in March, the supply is going to pick up significantly. So hopefully that's doable.
Great, thank you. And then my next question is kind of a different point of it. It'd be about the categories. I know that many physical rehabilitation sites check a lot of the same boxes that nursing homes and as well as assisted living homes do as well. Yeah. But many of those rehabilitation centers do not fall into that same category. So I'm wondering who kind of decides if they do or not, why don't they? And if they do, correct me, but I just would like to clarify that possibly for those individuals that are in those centers without a vaccine in their arm.
Yeah, so with some of those rehab centers, they wouldn't be the congregate living centers. And so that would be and it depends on also what you're looking at. If you're looking at a rehab center for like physical therapy rehab, those individuals would likely qualify under one of the other priorities. If you are looking at a rehab like alcohol or drug treatment rehab where people can live in those facilities 24/7, they are actually prioritized, I believe, in 1B if they have high-risk medical needs, which we are not to 1B just yet. But it also can be 1C. So that's when everybody who's living in a congregate setting that's not a long-term care facility will be able to get vaccinated.
Great. Thank you so much. I appreciate it.
Yeah, you're welcome.
We have Dylan Rosenblatt.
Hi, Dylan.
Hi, Dr. Christ. So a couple of quick questions for you. One, you mentioned on the top of this whole thing that you're aiming to add a couple of extra information topics to the vaccine dashboard. You mentioned zip codes as one of them. I'm curious what else you're planning on adding that we can expect to see.
Yeah, so the other things that we are looking at are adding the percent utilization by jurisdiction as well as the rate vaccinated. So those were in our infographics, but weren't. They had to pull data sources from other sources to get those in, so they're still working on incorporating those two values into the dashboard.
Okay, and then why wasn't zip codes included on the original launch of this dashboard this week? I know that's something that people have been questioning leading up to when the vaccine dashboard was going to happen, but it launched without the zip codes. Maricopa County just launched theirs with zip codes. I'm curious why yours didn't have one.
Yeah, we were trying to get out the vaccine administered data as quickly as we could. The data comes from a very, very clunky database that we were having some issues with not updating in the mornings. And so we wanted to make sure that we had that solid. We will be adding the zip code. It's a resource issue. And so as we get those maps built out and added to the dashboard, we will be doing that.
Do you have an ETA on when we can expect to see that?
Goodness, I wish I did. I'll have Steve follow up. Let me ask the team on that because they are actively working on it. But I think some of the team that is actively working on it is also our vaccine management deployment system. So like today they're down in Tucson deploying the vaccine management system like with the U of A. So let me ask them the time for that for you.
Okay, and last question.
Yeah.
I haven't seen anything on specific numbers about vaccines in the prisons, and I'm curious, have prisoners started to receive their COVID vaccinations yet? And has staff, and I know some staff and corrections officers were some of the first ones to receive it early on, but I'm just curious on what those numbers breakdown were.
I know that they've been working on the staff because we've been actively engaged with ADOA on vaccinating the prioritized 1B staff statewide. So I know that there have been several prisons that they have already offered staff vaccinations. You'd probably have to check with the Department of Corrections on their schedule for vaccinating of the prisoners. The only reason I say that is I don't know how many of them, because right now only those with high risk medical conditions would be prioritized in the 1B. population, and then the rest of the general population would be prioritized in 1C because they're a congregate setting.
But to your knowledge, do you know if any of those high risk received their vaccines yet?
Oh goodness, I don't know.
Okay. All right. Thank you.
You're welcome. Okay, yeah, I can do one more.
Okay,
yeah.
this is Brian Webb.
Okay. Hi, Brian.
Hi, Doctor. A couple quick ones. First, just making sure if someone has been sick with COVID-19, do they still need to be vaccinated? And secondly, what would you say to someone who is still reluctant to get the vaccine? Thank you.
So we are recommending that even if you have a history of COVID-19, you should still get vaccinated. The one caveat would be if you got COVID-19 and received the monoclonal antibody, so that bamlanivimab, or convalescent plasma during your treatment, we ask that you wait 90 days because you've already got the antibodies moving around and you won't mount as great of an immune response to the vaccine. But we encourage everybody because we don't know how long those antibodies to natural infection are going to last. And we do know that people can get reinfected with COVID-19. My recommendation to anybody who is hesitant or considering this, we would recommend that you get vaccinated. So we know that it's going to provide a safe and effective way for your immune system to respond without you having to come down with COVID-19. COVID-19 is even more unpredictable than influenza. And influenza historically has been one of the scariest things I've seen. And we want to make sure that everybody's protected because I've seen young, healthy people who have gotten very, very sick, requiring hospitalization, developing complications afterwards. And if we can avoid that and keep people out of the hospital and keep them healthy, that's better for their overall well-being.
Thank you.
Thank you.
Okay, thank you, Dr. Christ, and thanks everyone for participating.
Thank you.